Through giving and philanthropy, the College of Health and Human Services has been able to expand its work and have a greater impact in the community. Additionally, many students are benefiting from donations to the college. In fact, some would not be here today if it were not for the generous giving of donors.
Our donors are so important to us. They really give us the capacity to do what we envision the college is capable of doing. So many students depend on the generosity and the giving of others so that they can pursue their dream of becoming social workers or nurses or public health professionals or exercise scientists. And without that support, they couldn't pursue that dream.
I would just like to say thank you again to Dr. Harvey Murphy for giving me this scholarship. It's such a blessing, and I'm just very grateful, so thank you. I'm a pediatric brain cancer survivor, so I've had a passion, wanting to give back to children who are also going through battling cancer and things like that. So I would love to be a physician assistant working with pediatrics and children that have cancer. So receiving this scholarship has definitely pushed me and enabled me to keep going in this field so I can get that step closer to doing what I would like to do in the future.
And I think what has impacted me from this is actually someone doing for me, because I'm kind of the doer all the time. So it was just like, I got something, it's like, and everyone's like, but this is you, this is so you. So I think that's been the impact for me, is getting back something that I've put out for years and constantly helping others, that someone is able to help me.
I get letters from them, which I really appreciate, and I hear about what they're going through, what they're doing. I'm glad the funds are making money and still working and helping the students, because getting educated is very expensive.
What everybody wants to do is to make sure that they leave some kind of a lasting legacy. One way to do that was to establish an endowed nursing scholarship out here.
Well, I enjoy meeting the recipient because I like to see what she's doing, what she's interested in, what her goals for the future are. And I think it just seems a little more personal to me, or to both of us, to be able to really see the person and to see that this person is benefiting from something that we're actually contributing to. Some people think they have to have a lot of money in order to give money, and we don't have a lot of money. We've, like I said, we just wanted to be able to do something in order to help someone out here.
And no matter how much or how little money you make, you can do that if you set that aside and make it a priority. 30 years from now, when we're probably gone from this earth, people are going to be able to get a Jim and Nancy Health Scholarship, and they're going to ask, who the heck are those guys? And they may not know who we are, but they'll know that somebody cared enough 30 years previously to go ahead and establish a scholarship to help them get through school.
I do think that the scholarship endowment, from the way they have sent me a printout of how it's invested and how it's given out, which I really appreciate. It's the best one I have seen, and I'm so pleased that they're making money with it and utilizing it properly.
The College of Health and Human Services has the greatest opportunity to really invoke change in our community. Not only through educating people for the kinds of jobs that I think we want to attract to the Charlotte community, but because of Lynn's interest in really finding ways to connect with the community and make changes in the health services, people's attitudes and thoughts on nutrition and wellness. I really think she has a heart for changing in a very positive way the Charlotte community, and what UNC Charlotte can do to be a part of that change. I think it's just very inspiring.
I think just because the kind of issues we deal with really take the whole community to solve, and so having community members make an investment in the work we're doing is really validating and exciting, and it just allows us to do more work than we would have otherwise.
With the support of our donors, we're able to innovate in our communities, we're able to engage students at a very high level within communities.
I'm really excited because I get to represent the department in my field of social work, and it's just been exciting to always, particularly from a student perspective, really get the hands-on. And then to be named a leader, that was
honorable to me that we're able to engage in community work and be leaders while doing it.
Yeah, and I think the investment in Tacola has been amazing. That I do see her as someone who's going to make a real difference in our community, and having this kind of funding just allows us to take that to the next level, so that she can really have the mentorship, that she can have those experiences that are really going to put her in a good position for the future. By kind of, having these relationships with donors, then we learn about them and what they care about, and they learn about what we care about, and I think it really can lead to great things.
The research that we do in the college is so intricately tied to the community work that we do. One of the things that we're really focused on in the College of Health and Human Services now and in the coming years is to strengthen our research profile. And that is to give faculty who are our great thought leaders in the college about health problems the opportunity to not only go broad on health problems, but to go deep, to have the time to bring their graduate students and undergraduate students to problems, to solve them in comprehensive ways.
The Colvert Professorship is named after Dr. Colvert, and he is a role model. He's an inspiration. Anyone who's been around Charlotte for any amount of time knows the tremendous work that he's done, and to assume a professorship that's named after someone like that is very inspirational and really gives me something to shoot at. There are some big shoes to fill. What an endowed professorship allows me to do is now take some of that information, some of that experience, and apply it in a place where there's a talented group of faculty, there is a university that supports that vision and a college that supports that vision.
We have a vision set before us that is founded on health for all. We need to pull together as an entire community to do that. And all of the folks who give to us with their time or with their resources are a huge part of that, of our future, and of our future success.